So I urge members of the public, firstly, to engage licensed players. It's very important for you to engage licensed players because we are able to have oversight of how they operate and where they place their monies and what they do with them. So it's very important for you to engage these licensed players as published on our website and also in the newspapers at the beginning of every year. Secondly, it's very important for you to purchase a medical insurance policy. It's for your own good. It enables you to predict your expenses because you don't need to walk around with cash all the time. You don't know when your children will fall sick. You don't know when your family member will fall sick. And often, time and again, we have seen members of the public requesting for contributions. But you never know that when any of these members of the public will not be able to contribute. And so to avoid such scenarios, it's best for you to have a medical insurance policy as a backup. Medical insurance policy acts as a backup for you such that you have an assured partner along the journey, someone to be able to pay your bills. The policy may not pay for you 100%, depending on how much premium you're also willing to purchase. But as long as you're able to have a backup, you're also able to transfer this risk to the insurance company and avoid unnecessary inconveniences. Then thirdly, we have encountered complaints from the public every now and again. So if you're being faced by some challenges with your insurance player, please engage us. But remember, you have to engage the insurance company firstly, and if you fail to resolve a conflict, then you can proceed and report the same conflict to the Complaints Bureau of the Insurance Regulatory Authority of Uganda. We are here to receive the complaints from the public, and then we have the mandate and we have the power to summon the insurance company to explain the why and the how they have done what they have done and how we can resolve the matter together, such that we are able to reach common ground with the policyholder and with the insurance company. Of course, this conflict resolution is also in line with your policy document. So we can't run away from the fact that all operations of the insurance policy are governed by this policy that you sign. So even when we are listening to complaints, we have to do that in line, definitely with best practices and also in line with the policy that you signed as the policy holder. So please read your policy documents before signing. It's very important for you to know what is covered and what is not covered because it enables you to plan and to know what to expect. Do you have a co-payment on a particular benefit? Do you have a co-payment at a certain hospital? It's important for you to know these because you never know when you end up at that very hospital that has a co-payment, and then before you're rushed into the doctor's room, you're requested to pay that co-payment, and yet you won't be prepared if you had no prior information. So it's very important for you to know what is covered within your policy document. But first and foremost, more important than all those things, the insurance policy can only respond when you have done your part and after you have paid your premiums. So please pay the premiums that are due to the insurance company to enable them to be able to pay the bills as and when they fall due. Because without the premiums, the insurance company is also unable to plan for you. And so when they fall due, they might end up paying for you from someone else's premiums. But then it's very important for you to play your part such that we are not inconveniencing the insurance player in making promises to the facilities, and yet you have already received services from the hospitals. So please play your part, pay the premiums such that the insurance company is able to pay the bills as and when they fall due. As health encompasses so many things. So what falls into health might be a hospital cash, might be say a package that will enable you to have access to gyms. So there are different packages that fall under health because this health is broad. You're looking at someone's health, your health mentally, your health psychologically, your health physically, but medical insurance particularly will look to respond to medical bills. And then the insurer pays the medical facility directly. So after you have gone to the medical facility, your medical insurance policy, the insurer pays for the bills to the hospital, to the facility directly. But for health, health is broad. It also, if you're looking at subsets, medical is a subset of health. In health, there are other policies where they might pay you, the policy holder, after you have already spent at the facility. They can also pay you for incapacity. You have had a critical illness. They pay you yourself after you have spent or you have been diagnosed with cancer. You have discovered that you have HIV. So that's critical illness. It's also part of health, but it's not recognized as medical insurance because for it, the money gets paid to the policy holder. So medical in particularly, the insurer responds to pay medical bills to the hospital after the policy holder has visited the hospital. That is where the difference comes in.
Thank you.